Hello, my name is Ellie. I'm the manager here at Respshop. My job here is to support our medical and customer service team to give all of our customers the very best service possible. Today, we're talking with Dr. Singh. Pam is actually with us today as well. If Pam, if you could let everybody know what you do here with the team, that would be wonderful.
My name is Pam. I'm a respiratory therapist. I work with all kinds of customers from oxygen to CPAP to BiPAP to my AirView. So we handle those customers and work with them to make sure that they receive the equipment that they are being prescribed. So we might as well get started. And Dr. Singh, can you tell us a little bit about yourself?
Yeah, thanks for having me. It's a pleasure to be here. And so I'm board certified in sleep medicine. So I see patients that have sleep disorders from the gamut of sleep apnea to insomnia to narcolepsy. And I've been doing this now for the last several years. On our end, what we can do is we can see your patients, if they have sleep apnea or any other sleep issues, and we can assess where they're at now. Some of these folks have been on treatment for a long time. They need to maintain treatment. Some folks are just getting assessed, so they need to have a home sleep test done, and we can diagnose if they have sleep apnea, or if you feel like there's something else going on, we can help them with that as well. So we can do that assessment part, and then we can, of course, provide the appropriate prescriptions or whatever else is necessary to get them on appropriate treatment.
With your process, is there a time where you had to actually make a change with a customer to ensure their safety or to change their prescription a little bit? And if you have, can you tell me how you go about doing that? Is it something that the customer may mention to you that makes you change their prescription or their therapy?
That's a great question. So it depends from patient to patient, but we'll have some patients will tell us that, they may not be feeling their treatment is effective any longer, or they may feel like they're on CPAP and they may need higher pressures, or maybe they're on CPAP, or maybe they have central apneas, and we have to assess that part. So we can always modify therapy that's appropriate for the patient, that's appropriate for their safety, because, this stuff in the long run can be dangerous, right? So we want to make sure we dial it in right and we get them on the right therapy, and we're here to do that and make sure whether they need CPAP, BiPAP, ASV, that we provide the right treatment option for them.
What steps do you ensure that the prescription that they're receiving is appropriate for them? So for example, if I'm with you and I explain to you that I've been on therapy for 10 or 15 years, I'm on right now CPAP of 10, and we have that discussion, like what would you recommend, or how do you go about recommending that therapy? If I'm telling you I'm not sleeping, I'm still having issues, I'm waking up middle of the night, maybe my legs are really hurting in the morning. How do you go about assessing those types of situations with our client?
Right. So in that type of case, or in any case, really, we want to do a comprehensive evaluation in terms of, hey, what are some other sleep issues that you're having? Are you having a hard time falling asleep, staying asleep? Do you have comorbid insomnia? Do you need a lab study, right? In some of these cases, the patient may need to get into a lab and be assessed in a lab. Maybe they're no longer tolerating therapy because maybe they have a heart condition now, right? So maybe they developed AFib, maybe they developed CHF, maybe they're having central apnea, so they might need a lab study. And so it's really important that we get that and dial that in right, because it's going to make the biggest difference for them going forward, that they're on the right therapy.
After you meet with the patient, do they schedule a follow-up appointment with you to make sure everything's going well, like in a month or 6 months, or what's your recommendation there?
So we tell every patient, because again, we're seeing patients across the country, that they should have follow-up. Some folks want to follow up locally. They want to get in with a local provider they've been seeing for a while, or now they're finally are going to be able to get in with a pandemic. I know it's really hard to get in for a lot of folks, but that's opening up a little bit. So we always recommend that follow-up. And, if they can't, then we want to see them back, and usually 4 to 6 weeks is a good time to see them back and just make sure things are going well.
When you're meeting with the customer how do you help them so that they can stay compliant with their therapy? Because we do see a lot of customers that will call us back and they're having issues with their mask, or they're having issues where the pressure is too high and they want us to make that recommendation to drop the pressure. And it's difficult for our patients to understand that we really need a prescription to do that. They really just want us to do that. What do you recommend for our customers in that situation?
Yeah, that sort of situation, again, it gets back to follow-up, right? So, we want to touch base with you again and see, hey, what's going on? We want to really figure out the problem. Too many times we know people aren't compliant because there's no one out there trying to really dive in to figure out what the issue is, right? Is it a mask issue? Is it a pressure issue? Is there something else going on medically that we need to figure out, right? So we got to dive into the issue before we can. And so it's important for them to understand that, even if you think you need a pressure change, we need to, as physicians and as providers, be able to understand that and then recommend it to you guys to be able to do that. Once we do that, we know a lot of times it's smooth sailing from there on. It's just a matter of doing that initially.
So with somebody who's new on CPAP that you've seen that you're going to prescribe auto CPAP, what do you recommend for them to help transition to CPAP and CPAP pressures, to help them so that they have that transition of the night to make it easier for them to fall asleep? What are some of your recommendations for those clients?
Yeah, first-time users, it's always about, many of them have issues in terms of acclimating to something on their face, right? Mm-hmm. So our standard protocol for that is, just use that desensitization where you're actually awake, right, before you go to sleep, and you're actually getting used to something on your face. And then over time, we know that you're going to acclimate to that, right? As the brain gets used to something on your face, you're going to have an easier time falling asleep. Even start the machine, have some pressure blowing so you feel how it is to get a little bit of pressure. That makes a world of difference. If they just do that for a week or two, the data is very clear too, that people are going to tolerate CPAP a lot better and be compliant. So that's the number one thing, is get that time for desensitization if you're having a hard time. The other thing is that sometimes in the beginning, patients need to, when they're in auto CPAP, they need to make a little adjustment in their pressure, right? So some folks may feel like they're gasping or suffocating, having that air hunger, right? So at that time, we want to up the pressure a little bit, and which can make a big difference too. And then you have the opposite. Some folks, they see that the pressure is going up a little too much, and then they can't tolerate the higher pressures where we want to reduce it.
So what can we do to help our customers sleep better with CPAP or BiPAP? Do you have any specific recommendations for us on the professional team that we can share with our customers to help them so that they get a good night's sleep?
Yeah, I think the biggest thing you can do to help them is figure out the mask as early as possible, okay?
Okay.
Because, when you figure out what's comfortable for that patient, how they breathe, whether it's needing a full face because they're a constant mouth breather, right? Or maybe a nasal mask, maybe they started out as a mouth breather, but a lot of folks, when we treat their apnea, they turn into obligate nasal breathers, which we're meant to do, right? So figuring that mask issue out as soon as possible is great. If you can, if a patient's having an issue with that mask, if you can, maybe change the mask at one time, that'll go a long way, right? So helping them acclimate and adapt to CPAP in that way. I think the other thing you're doing already is just following and making sure that the pressures and where they're at, if any adjustment needs to be made, and then keeping me involved in what's going on will go a long way as well. I think those two things really are keys to compliance and really are keys to being successful for patients in the long run. And nowadays we have the technology, right? We got the cloud technology, we got the technology that's for us to monitor these folks, and in the long run, we know if we do that, hey, we're going to prevent heart attacks, strokes, depression, dementia now. We know all these things are prevented in the long run, right? So it's great. We got this technology available to us now.
My last question I have for you, unless you have questions for us, and feel free to ask, how would you explain to a customer how important it is to use the CPAP, and why is it important to continue to use it?
Yeah, no, absolutely. That's very important to educate our customers and our patients in terms of why we are treating this, right? So, and now again, we got data. There's lots of data. right? In the past, we didn't have that. People have often asked, like, okay, this was my mom probably had it, my dad had it, and they never got on treatment and they seemed to do okay. Well, guess what? Did you see like how they were struggling the last few years with their blood pressure or the palpitations that they were having, or maybe they died uh, for a reason due to chronic sleep apnea, right? We don't know. The data is there now that proves that if we can get your apnea treated and you're compliant, we're going to help the quality of your life and help prevent these chronic diseases. Even blood sugars with diabetes, we see it, right? They get better when we treat sleep apnea.
Mm-hmm. Yeah.
And
So it's
high blood
important to
pressure. Have you
understand
seen high blood pressure too with the situation with everything?
absolutely, absolutely, hand in hand, right? So blood pressure improves. I've seen people even stop their medications or get lowered. Their medications get lowered because they've gotten their apnea treated. So that goes hand in hand.
I do appreciate your time with us today. Allie, do you have any questions?
Just wanted to quickly go through how our customers can reach you. So just as a background, on our website, which is respshop.com, we have all of our services listed on the website. So that's how you got to reach Dr. Singh. So the two things that he offers for us is a prescription renewal, which we've talked about, and of course, a sleep study. And of course, if you want to do that, you can just order it online, email us, chat us, call Pam, any of those things. But what I just wanted to quickly talk about is after the customer signs up and makes that appointment, can you just quickly talk about what the next steps are, like with the meeting and things like that, just so that they're prepared? Because I know a lot of customers are sitting, waiting by the phone, not realizing that they have to log in. So I just wanted to quickly give that information so that they know how to reach you.
Yeah, no, absolutely. And again, thank God for technology because it's so easy nowadays, right? So you can just get on the website once you make an appointment, right? So then what happens is you actually get an email forwarded to you that shows you the link that you have to go to at the time of the appointment. It's a Zoom link. So you click on the link and that's it. You're on board. And then you just wait for me or one of my providers to click on and talk to you that way. I mean, we know also there's going to be glitches, right? So if there is a glitch in terms of you being able to get on Zoom or us being able to get on Zoom, maybe the bandwidth is down and that sort of thing, we have your phone number there. So we'll always expect someone to reach out to you no matter what. We're always going to reach out to you, whether it's by Zoom or by phone, and make sure we connect.
Is there anything else that you'd like to share before we let you go? Because I know you're very busy.
No problem, no problem. No, I think what I would like to just keep in mind is that, and for you as well, for you all, when you have a patient that is still struggling despite your attempts, maybe changing the mask, the pressures, there may be something else going on. So don't hesitate to redirect them back to our website, and they can always make an appointment again for us to like go over things in more detail to see if there's anything else going on that could help them, right? Because we know with sleep disorders, it's not just sleep apnea. People have insomnia, restless legs, narcolepsy, and these things need to be teased out as well. And that's what we pride ourselves in, is that we do a comprehensive job in trying to really figure out and help your sleep overall. And that's going to make the best outcome for everyone in the long run.
That's perfect. Thank you so much.